The last video that I did was talking about the differences between a lumpectomy and a mastectomy and the advantages and disadvantages of each of those. This video is going to talk about single mastectomies versus double mastectomies, defining those, giving alternative names that you might see pop up that you don't recognize, and now you will. And we're going to talk about the advantages and disadvantages of those, and I will share my personal story. Let's get started. You're never told that life could ever get this way. So a single mastectomy is also called an SMX or a unilateral mastectomy. That is where only one breast is removed. Initially, that is what I had, was a single mastectomy. The right breast was removed because that was the one that was affected. The left breast, they thought, was not affected at all, so that one was left. So I had a single mastectomy, which is also called an SMX or unilateral mastectomy. A double mastectomy is also called a DMX or a bilateral mastectomy. That is when both breasts are removed. They may be removed because both breasts are affected. They may both be removed because the patient wants them both removed for various reasons that we will go into later on in this video. What's the least complicated way to do a DMX or a double mastectomy, bilateral mastectomy? That would be if you're not planning on having any reconstruction. That would be aesthetic flat closure. And I will talk about that in a future video when I talk about reconstructive options. But I will leave some links below for groups that you can join. My group, which is a general breast cancer support group, we do talk about that sometimes. And then specific groups that talk about specific types of reconstructive options. So you can go to that ahead of my recording or in conjunction with that recording on reconstructive options. But the simplest DMX or bilateral mastectomy, double mastectomy, is one where you decide to go flat and they remove the nipple and the areola and there's an incision across your chest. If you decide that you do want reconstruction, which sometimes you can choose that and then decide to go flat later, that one may or may not remove the nipple and areola. It's going to be skin sparing so that you have some tissue for the reconstructive surgeon to work with. Now, I cannot guarantee that you won't have complications. Most of us, depending on what type of reconstructive surgery we choose, most of us don't have complications, but they are possible. The cosmetic outcomes used to not be so great, but over the last 10 to 20 years, they've improved dramatically. The type of reconstructive option you choose, there might be more complications with one over another, and that is why I encourage you to join the reconstructive support groups to get some education on that as well, that I may or may not be able to provide you. A bilateral mastectomy has more complications than a single mastectomy. That's what surgeons will tell you. And yes, there are naturally going to be more complications, or it's going to be more complicated. They will tell you that you're going to lose sensation quite a bit in your mastectomy. So, but I want to share some anecdotal evidence. Yes, I have lost sensation on both sides, but the left side still has some sensation, where the right side doesn't have much sensation left. And it's not just due to the mastectomy. The difference between my left and right side is that the right side, my right side, was the one that had the cancer in it, the one that they identified cancer in at least. And so I had a mastectomy on that side first with the left, it was remaining. They removed all the lymph nodes in my right arm, and I had 30 rounds of radiation. So I'm naturally going to be tighter on the right-hand side versus the left, which they did not identify any cancer in until later, and I'll get to that in a little bit. And there were no lymph nodes removed in the left side, and there was no radiation removed to the left side. So coming from the point of view of a breast cancer survivor, a pink sister, that lack of sensation isn't just due to a mastectomy. It can be due to how much treatment you have had on one side or the other, or both. Part of the reason that they're going to tell you, and this is true, that a double mastectomy with the plan for reconstruction is more complicated than a double mastectomy that's just aesthetic flat closure, or a single mastectomy is going to be less complicated, is because with a double mastectomy with the plan for reconstruction, you may have several revisions. Now, personally, I had a single mastectomy, and I'm going to have to get into this in a little bit, or I'm going to lose the focus here. But I had a single mastectomy to the right side. They put an expander in so that the skin that was spared could grow over time and allow for a DIEP flap, which we will talk about. It's a transfer of fat, but I don't want to lose focus here. We're talking about single mastectomy versus double mastectomy, but they put an expander in here, a tissue expander, so that it would allow for transfer of fat with my reconstructive choice. I had to wait for almost a year for that reconstruction to happen. And yes, most people who choose that reconstructive option do have several revisions. You can stop at any point, usually, that you want to. And yes, could I have more revisions? I probably could. But I personally chose to just stop where I was. I could have had the left lifted to match the right. It can be a very personal choice. It was with me. Yes, I could have more revisions, but I chose not to. So when they say that a mastectomy with reconstruction has more revisions, that depends on if the breast cancer survivor, the pink sister, wants more revisions. I didn't choose to have more revisions, but if you're wanting to feel more symmetrical and more even, you might choose more revisions. So now, why might a surgeon recommend a double mastectomy, a bilateral mastectomy, a DMX? There may be several reasons. One is if cancer is found in both breasts. And I've been researching this with videos that breast surgeons have made, and a lot of them say, but if it's a small cancer, we can preserve the breast. I've talked about this in the last video, talking about the difference between a lumpectomy and a mastectomy. A lot of them think that we might be more concerned with preserving the breast, and that is your choice. If you want to preserve your breasts, then that's your personal right. But we also need to look at the other side of this. Some people, yes, they might naturally want to preserve their breasts, but they also want the likelihood of clean margins to be higher. So they might opt for a double mastectomy. But if it's in both breasts, some surgeons will recommend a DMX, double mastectomy, bilateral mastectomy. If there is a high history of breast cancer in your family, whether or not it's genetic or it's just environmental, they may recommend that you have a DMX, double mastectomy, bilateral mastectomy. Also, if you opt for a lumpectomy and it's in both breasts, please know that even without the concern of having to go back in for additional surgery, you are most likely going to have radiation. I talked about this in the previous video where I compared lumpectomies to mastectomies. Almost all surgeons are going to tell you that if you opt for a lumpectomy, you still have to have radiation. And some people may be coming into that with heart problems. And to reduce your likelihood of that being exacerbated, you might choose a mastectomy over a lumpectomy. You can go to the support groups and find this decision in many of the discussions. A lot of women who have heart problems or history of heart disease, they're going to opt for a mastectomy, maybe, to reduce having to have radiation. But then again, they might have to weigh that with the complication of the surgery, because that can also have risks. So it's something that you need to discuss with your surgeons, and maybe discuss with other Pink Sisters, breast cancer survivors that have that situation like you. If you have breast cancer in both breasts, you may develop a new breast cancer in one or both breasts if you decide to go for a lumpectomy instead of a double mastectomy, if you're preserving both breasts. If you carry a BRCA gene mutation, or you have other genetic connections to your breast cancer, your likelihood of developing breast cancer in the future increases by 50 to 60%. So that is part of the reason that many breast surgeons recommend that people like Angelina Jolie and others with the BRCA mutation go ahead and have a double mastectomy. If you had radiation for lymphoma as a child, you also have a higher risk of developing more breast cancer. So that may be another reason that a breast surgeon may go ahead and recommend a DMX, double mastectomy, bilateral mastectomy. Okay, let's talk about advantages and disadvantages of having a double mastectomy, a DMX, bilateral mastectomy. The disadvantages the surgeons are going to mention, I've already mentioned a little bit before, and that is that anytime that you have a more complicated surgery, you're going to have more complications. Anytime you have a surgery, you're going to have more complications. And if you watched my previous video, or you went to go and watch it, I talk about how many Pink Sisters and breast cancer survivors arrive at the decision of a mastectomy because they also want to reduce the likelihood of having to go back in for an additional surgery, which every time you have surgery, you're going to have increased complications. So that argument, you need to weigh anecdotal evidence with what the surgeons are also saying, and not dismiss what Pink Sisters are saying as participants in their journey as well. So the complications can also be increased by having to go back in because of lack of clean margins. The second argument, or the second disadvantage that will be mentioned, is usually lack of sensation. Again, we as a breast cancer community, as actual patients, have anecdotal evidence. Yes, you will lose sensation, but sometimes the degree of sensation is not just dependent on having a mastectomy. It can also be increased. The lack of sensation can be increased due to what else was done to your breast. So like I said, on my right side, I had a mastectomy that was more it was more radical than the left. The left was a prophylactic mastectomy. The right, I had a mastectomy on the initial mastectomy. And not only did I have a mastectomy there, but they also took all the lymph nodes out, and they also did 30 rounds of radiation. So of course there's going to be less sensation on that side compared to the left. So I encourage people not to dismiss what the surgeons are saying, but on the other hand, please don't dismiss the anecdotal evidence that we as a breast cancer community can provide you. I think both need to be weighed. As far as advantages to having a double mastectomy is that it decreases your chance of developing breast cancer on the other side. It doesn't 100% decrease that chance, but it does decrease the chance of developing breast cancer on the other side. Also, you don't have to have any more mammograms if you have a double mastectomy. Now, there's an argument that that can be bad news too, because there's less surveillance that way. But I can talk about that in future videos, because I don't want to lose the focus here. But some people prefer not to have to go in for mammograms for the rest of their lives. And also, reconstruction is more likely to have symmetry. So more and more Pink Sisters are opting for a double mastectomy. And at the same time, surgeons are hesitant. And I already talked about them worried about the lack of sensation. They do need to warn us of that. I'll give them that, because they don't want us upset probably that we have lack of sensation. They want to make sure we're aware of that. But like I said, that isn't just dependent on a mastectomy. It can depend on how much treatment you have on one side versus the other. And also complications. And I also mentioned that lumpectomies can increase your chance of having to go back in for additional surgery as well. And any additional surgery you have can increase the likelihood of complications. One thing that I do agree on with them is that just because you remove your breast does not mean that you won't become metastatic, or you won't develop breast cancer somewhere else or even in the same site. Getting both breasts removed does not reduce the likelihood that you're gonna have breast cancer again. Another argument that they're gonna make is that having a hormone blocker will reduce your chance of getting breast cancer again by 5 to 10%. Now, there are complications with that as well, because not everybody takes well to hormone blockers. The majority of us do manage hormone blockers fine, or the risk versus the benefit, it weighs more in the benefit of taking hormone blockers. But there are some who cannot tolerate hormone blockers, so that argument isn't always relevant to every single person. And like I try to stress in almost every video and in my support groups, every person is different. So you may have complications in one place where somebody else doesn't, and not have complications in another place where somebody else does. And some people even argue that you can always go back and get a mastectomy on the other side, but you can't get your breast back. And it's kind of like the slogan, save the tata. A lot of us will say, we're not trying to save the tata, we're trying to save the woman. But again, so that's a personal choice. It needs to be your choice and not the surgeon's choice. You weigh what the surgeon's saying, because you need to take in their advice, because this is what they do for a living. But also, I think you need to add in the anecdotal evidence that many of the breast cancer community can provide as well. Put those both into your decision process. Recovery from a double mastectomy is probably going to be harder for you than recovery from a single mastectomy. I will talk about that in a future video about recovering from a mastectomy and things that will help make your recovery run more smoothly. But yeah, I had a single mastectomy to the right, and it was hard to get up from a reclining position, and there are some things that I will include in that video of mastectomy recovery that can help with that. But it probably is doubly hard to recover from a double mastectomy because it's on both sides instead of just one. I've been watching other videos about single mastectomy versus double mastectomy, and they're saying it's a controversy. They're saying that's such a drastic move to have a double mastectomy for such a little cancer. And most of the people that make that argument, some of them might be surgeons, but a majority of them don't have any relationship with breast cancer, or they're not like directly related like we are with the decision that has to be made. Ultimately, the decision comes down to what you want individually, what you want to make, because I'm going to talk about this closing this video. There are different reasons that somebody chooses a double mastectomy, and in the end, it is a personal choice. We have to live with the results. We individually have to live with our results. The people around us don't have to live with those results. We do. So they don't have to deal with self-image and worrying about lack of symmetry, or worrying about whether their prosthetic is going to fall out. I forgot to mention prosthetics, but you can get a prosthetic if you do decide on a SMX or single mastectomy. That again is your personal choice. And yes, the prosthetics are improving over time, but that's something that you have to live with. Other people don't have to live with that. That's your choice. Whether or not you have kids after a mastectomy or another child after mastectomy might be a decision that you personally will make. Other people can't make that for you. Other people aren't deciding whether you have kids or have another kid and you decide to remove both breasts and just give them formula, or you remove the one that was affected by cancer and keep the other one available for breastfeeding. That's up to you and not the person that isn't living with this decision. You have to live with this choice, not them. Most of us as breast cancer survivors sometimes have the fear of it going undetected in the remaining breast, and I will talk about my personal journey here in a few minutes. People outside of breast cancer journeys don't usually have to live with that fear. So again, it is your choice. Other people aren't paying your medical bills usually. So again, it is your choice, because many of us decide on a double mastectomy because it's likely that we won't have as many surgeries, which means that we won't have to pay for as many surgeries. It's very important to listen to your surgeon, but they can't be the end-all be-all to your decision for whether you want a single mastectomy or a double mastectomy. We do need to take into account what they're saying. This is their livelihood. This is what they do for a living. So they have a lot of valuable information. But we in the breast cancer community also have a lot of valuable information, because we are the ones that experience the results of a single mastectomy or a double mastectomy. So ultimately, it has to be your choice, because you are the one that has to live with the results of that choice. And statistics and research cannot measure how we feel on the inside. Okay, so story time. I had a diagnosis of stage 3 invasive ductal carcinoma in my right side. That was my initial diagnosis. I was diagnosed in January of 2015. I had 4 rounds of adriamycin cytoxin and 12 rounds of Taxol, because they wanted to shrink the 7.5 centimeter tumor and also hopefully eradicate any breast cancer in my arm, because they found that my sentinel node was positive for breast cancer. So I had the chemo prior to my surgery. With follow-ups of MRIs and CT scans prior to my surgery, it showed that the chemotherapy was very effective in reducing the cancer, pretty much shrinking it almost to nothing in the tumor. But they automatically removed the lymph nodes from my right arm because it was already found positive prior to the chemotherapy. They removed all those lymph nodes. 4 of them came back with traces, minute traces, but traces of breast cancer in 4 out of the total 11 lymph nodes. Everybody has different numbers. 4 out of the 11 were found to still have cancer in them. So I had to have 30 rounds of radiation. Okay, that was over by November. They did not mammogram my remaining left breast until December. And I was in the internal waiting room after they did a mammogram, and they called me in for some ultrasounds because they said there was something suspicious on the left. And then I end up having to schedule another appointment for a stereotactic biopsy so that they could remove that area in question. I was diagnosed with atypia. Mind you, I had just gone through pretty much a whole year of active breast cancer treatment, so I was in no mood to have to face that again. So see, people can't just look at a patient like they're a patient. They need to look at patients as if they're people, and every one of us is different. Every one of us has different responses to that. We might handle some things fine, and other things are almost intolerable, and then other things are intolerable to us but fine. And we're different than the next person. The next person might have a harder time with something that was easier for us, or an easier time with something that was harder for us. So they didn't know that there was anything going on with that left breast. It was not picked up. And also, the pathology came back from the right side that there was lobular carcinoma in there. They didn't know there was lobular carcinoma in the right side when I had that mastectomy. So I was very tired of the thought, the very thought of having to do active breast cancer treatment again. I was in no mood for it. So I knew that I was going to have a DIEP flap that following summer. And I knew that you could have a mastectomy, a prophylactic mastectomy to your healthy side when you have your reconstruction. So I asked my breast surgeon to remove my left breast when I had that DIEP flap. She hesitated, but I insisted that I was tired of this. I didn't want to face being poked and prodded for another year, almost directly out of the year that I was dealing with for the right one. So she eventually understood where I was coming from, being a breast cancer survivor. So I had that remaining left breast removed when I had my DIEP flap, which was that summer of 2016, almost a year out from my mastectomy. They took that breast tissue to pathology and they found lobular carcinoma in situ. They will refuse to say, or at least at the time of the surgery, they refuse to call that cancer, even though it's cancer that's contained. And I've watched some videos about that with other people that have been diagnosed with an in situ. It's contained and they watch it. Okay, granted, I understand them wanting to watch it and not remove it. They want to watch it, but it's kind of like saying that somebody's not pregnant, but they are pregnant because the child grows and then you're pregnant. You're going to have a baby. The same with an in situ. That's cancer. It just hasn't grown outside of where it's contained. And in these other videos, I don't want to lose too much focus, but these other videos of people that have had an in situ, I forget what it's called, but it's something necrosis. It's where the cancer has eventually gone outside of that containment. And then also there's evidence that subsequent cancer diagnoses can be more aggressive than the original ones. So there's a lot more to take into account than just statistics and research that surgeons have had. There's a lot that goes on mentally with a breast cancer patient that some people don't understand. They don't experience it the way that we do. So that is the long story short. It's kind of weird when people ask me if I had a single mastectomy or a double mastectomy. It's complicated. I had a single mastectomy to the right side, and then I had a prophylactic mastectomy to the left side. So it's kind of like having a double mastectomy, but kind of not. But hopefully my personal experience with this can also help you weigh what you want for your personal choice of a single mastectomy or a double mastectomy. I want to talk real quick about prophylactics. I was completely flat on the right hand side for almost a year before I had the DIEP flap, which you will learn about in another recording, or you can go to the support groups that I mentioned below. So I also mentioned in one of the earlier videos, I believe I mentioned about the knitted knockers. So I had a knitted knocker on the right hand side. And again, when you have to live with prosthetics, you don't know what it feels like unless you've dealt with it personally. It is kind of weird, and some of us have to approach it with a sense of humor. But those do fall out sometimes, and it's an awkward situation, and people outside of a breast cancer journey don't understand that. But ultimately, it's your choice. And before I go, I want you to see the shirt. It says Survivor. I bought this shirt to help fellow breastie out. She has her own ministry to support breast cancer survivors. It's called Blessing Box Project. I will leave a link to it down below. I bought this shirt to help pay for postage. What she does is she usually has weekly sew-ins on the weekend, on Saturdays, and they sew a mastectomy pillow and a drain shirt, and they send them to people that are going to have a mastectomy, whether it's single or double. They prepare them for a mastectomy. Sometimes those pillows help with comfort levels, and also the drain shirts are going to help y'all. I will talk about what drain shirts do in the next video, but I encourage you to go to Blessing Box Project, and if you are getting ready to have a mastectomy, if you decide to have a mastectomy, I encourage you to sign up for a free mastectomy pillow and drain shirt. And if you want to pay it forward, I encourage you to buy one of these shirts to help pay postage for her ministry. If you feel that this video was beneficial for you, I encourage you to like it and also subscribe for future videos. When you like and subscribe to my videos, it brings up the algorithm on YouTube so that other people can benefit from it. I encourage you to subscribe so that you don't miss the next video, which is going to be talking about preparing for a mastectomy, double or single.
You're never told that life could ever get this way. This bill's a joke, you're broke, your love life steal weight. This journey feels like you're in second gear, where it hasn't been your day, your week, your month, or even your year. But I'll be there for you when the rain hits the door. I'll be there for you because I've been there before. I'll be there for you, and you're there for me too.